Hey guys. How's it going? Good to see you guys. Anybody want to do? Oh, your class starts in July. Awesome. I hope I can help you out. I teach from the certification exam point of view. And if you turn your phone or device to landscape mode, I have a new practice exam question up that is from my site in cardiology if you want to work on it. Kind of nervous? Don't worry. Don't worry. You're going to do great. It's perfectly normal to be nervous too. It's going to happen. But don't stress. You got this. I'll help you along the way. I teach for free 4 nights a week here on TikTok and on YouTube. So I'll help you out. I love the medical field. It's been a great career for me. It's helped me raise my 3 sons, and it helps me help my mom now, so love it. You can put in chat what you think the answer might be by looking at, all you got to do is click on A, B, C, or D if you're on my site, or just type into chat what you think the answer is. What we're going to do is go to the answers first. Before you read any words of the question, always go to the answers first. Look up the differences between those CPT codes, and only those differences, like if one of them is arterial, one of them is venipuncture or venous, you only need to look through the question for that difference. This one happens to be in the common iliac artery, so you know you're in an artery, not in veins. That could be very, very helpful. Let's see. Iliac. Femoral artery, we do have an aneurysm. We have an endograph. They did use some fluoroscope. are you updating your digestive notes system for 2024? Should be on this site here on my website. Let's see. Did I do digestive? Shop. Let's go to CPT. Let's see. We got nervous system, I just did. Urinary, respiratory, musculoskeletal, auditory, anesthesia. I think the digestive got updated last year. Yeah, and they're still really good. There is not any new codes in this section from last year, so use these from 2023. They're perfect for what you're going to do. Let's see, what can we... They have all the prefixes, suffixes, all that good stuff. Yeah, they're going to do just fine. All right, let's go to a bonus member. Let's go to the cardiology part. And let's get back down here. In the bonus area, you've got all these extra PDFs that you get to download for free about cardiovascular and hypertension, all kinds of stuff. But let's get back down to Fitzgerald. Was this one? This one was it. Yeah. I'm doing cardiovascular, taking the pictures now for the 2024 update. There's only like 4 new cardio codes for 2024, but I do want to make a couple of additions to the Appendix L. So I'm retaking the photographs now for cardio for 2024. What do you guys think the answer is to this question? If you can see the question, I'm hoping you guys can. Camera is loud today. Good. Good. Let me know in chat if you got any other questions. Do y'all recommend any online courses to receive this certification? I don't. You don't technically need any prerequisites or anything for this career. All you need to do is pass one exam, either through AHIMA or AAPC. I recommend getting the AAPC because they give you 2 attempts for the price at passing the exam, and I recommend getting the CPC and a CRC certificate, 2 certificates. The CRC only takes 1 book, and it's just the diagnosis code book, that's ICD-10. And if you've already passed your CPC, it's fairly easy to get that certificate too, and medical offices are actively hiring for CRC. So having both gets you more income and puts you a step ahead for everybody else. And it's expensive enough to have your membership through AAPC, to buy your books, because you need 3 manuals for your CPC, and the exam attempts. So that's enough money right there. So don't buy a course. I teach from the exam point of view on how to pass them. And that's really all you need to do is just pass your certification exams and then get you that remote job and have a great life. If you do a medical course, more than likely you're not going to be happy with what you paid, and you're also not going to be happy with what you learned. I've met one, maybe two people out of the last 4 years, out of thousands of students from medical courses that really enjoyed their course and thought they got a good value of it. Most people say they wish they had never done it and spent that money. So do a survey whenever you're out chatting with people. You can even ask here in my chat of the people that have taken a course, would they do it again? Most people wouldn't, so I'm not just talking for no reason here. Thanks for sharing the live. Thanks for all the hearts and tapping the screen. You guys are wonderful. Love it. Thanks, Patty. You like the 07? Let me click on the 07 and see if you're right. You are correct. Good job. That is correct. There is some rationale that goes with it. Very good job. Who did that? Alicia. Good job. There is a couple of anatomy term questions there. You can type in chat what you think the answer is. Chicago Cubs, you passed your CPC exam. Yay! I hope I helped you out. Thanks so much for coming back to let me know. Congratulations. Where are you off to now? Do you have a job waiting? Do you know what you're going to be when you grow up? Are you going to get a second certificate? What's going on? That's so exciting. So proud of you. I hope something I said or did made a big difference. And made it a lot less stressful for you, for sure. Hey Patty, I saw you last night on Duran's Live. I like watching him before I go to bed. The one wheel can put me to sleep on the roads. I like watching that one. I have a blog here, Patty, on my website. If your daughter has seen my website, medicalcodingbyjen.com, and the blog is completely free. If you tap on the blog and scoochie down here, I've got a blog called, that alert one is kind of cool too, but there's another one right here, Unlocking Your Career and Tips. Really good advice right here, and where to find the jobs, what healthcare companies are hiring, the names of the companies that are hiring and some more advice, be sure you send her at least that she can read. The other thing I would recommend, Patty, is that she changes her resume every time she applies for a job. Don't send the same resume. Also, underneath the FAQs, under the resources right over here in the top corner, let me see if I can't bring that over. Yep. If you go to the FAQs right there, let me get there real quick. Scoochie down to the third sentence where it says the best list of free resources. Be sure to show her this one that is the CMS website. Let me show you right there. That one right there. If you go there, there's free certification classes. Like the one that my job makes me do is the fraud and abuse training. All of these, every single one of these is a course, and you can get a certificate for each one that you do, and you can add those to your resume that you've done courses through CMS. This is the official CMS Medicare website, and all these trainings are free too. She can do the grievance and appeals ones. There's unlimited exam attempts. She can keep taking the course over and over again till she passes and gets a certificate. They're completely free. They don't collect your information and sell it, nothing like that. But this is the one that I have to do every year with my job. And any one of these, even the diagnosis coding using the ICD-10, I know it's probably silly for her to do it, but just having it and redoing and rehashing some of that stuff is super helpful. But she can learn about different claims forms like the 1450 and the 8371. Just a lot of different certifications that she can add to her resume. Also, when she does apply for a job, if the prospective employer has like any company on there saying we want somebody that has knowledge of maybe MDS data warehouse, and she knows nothing about MDS data warehouse, she should go to their website, contact their sales department, and say that she is an employee with a medical group who's considering new data warehouses. Do they have any educational material that they would like to pass on to her providers? They will set her up with an account, probably let her play in the system. They may send her some PDFs, even screenshots of what the system looks like and how to use it, and all for free because they're a sales team. And then when she goes to interview for a job that has a system that she's never used, she can say, I've never personally used it for patients, but I have done training with MDS and I love their system. This is what I like about their system. This is what I wish they would update in their system. She may have some common ground with her prospective employer about the system, and they will love the fact that that person went a step ahead and learned about the systems of her new prospective employer. She needs to be really active in being, or aggressive about trying to find a job, you know. Don't just sit back and wait for somebody to pick her. She needs to go pick them by learning all there is about that position. If she doesn't know what EHR system that employer uses, you said something about a specific hospital in Hawaii that she wants to work for, she can walk in and go ask any front desk person, which EHR do you use? And if they tell her Epic or whatever, she can go to the Epic's sales team site and do what I just said and get some learning about it. Go to YouTube videos. I think there's even Quizlet has practice exam questions on Epic, if Epic happens to be it. But there's a lot of resources online when you want to learn about different systems that companies use. Don't sit back and just wait for a job. Go be active. Every health fair, she should join the Chamber of Commerce there in Hawaii. Find and get on their email list so that every time a medical office opens up a new x-ray wing or a new laboratory opens or a new helicopter pad ambulance thing opens up, she gets in the know ahead of time, and when they have their open houses, she can go. You get free snacks, which is great. They always have cookies and drinks there. But she can also take her resume and say that she is a local medical coder. If they ever have any issues with not being able to figure out why a claim won't be processed, she is in the area and would love to help them. And, and then walk away. That they will remember you. The medical community is a very small community. Even if you are in Hawaii or wherever you might be, you could be in Los Angeles, and it's still a small community. But every single health fair, every single event that has to do with anything in medicine, she should be attending on the weekends when the insurance companies or the dental offices are there passing out toothbrushes. She should be there passing out resumes, letting them know she's available in their area. She should try with home health agencies. Those are often the very first place that new nursing staffs get their first jobs. No one will hire a nurse fresh out of school with no experience except for home health agencies and hospice agencies. So that would be a great spot for her to try. Outpatient surgery centers or ambulance services have high turnover rates too. She should try those locations. Don't forget, Amazon just opened up a new medical wing in their system. For $6.99 a month, you get unlimited online visits with providers. And if they can't see you online and they need to see you in person, they've partnered with Walgreens or CVS or somebody, and you can walk into those places still and get seen for your $6.99 a month. They have a new pharmacy line that's $9 a month. I joined that one and I got a reduction of my meds and at $300 a month. It was great. But both Amazon's divisions will need coders for those particular areas. Don't forget about EHR systems. They hire medical coders to scrub their systems, to look for errors in their medical coding system. So she can look at data warehouses for medical infrastructure like Epic EHRs, startup companies that are making new medical charting systems. They all need medical coders. All the pharmacies, the radiologies departments, just a ton of people utilize CPT codes. Don't forget about the World Health Organization. They hire remotely. The schools, there's 1 million schools. Even her local community college will have a course in medical coding. From time to time, they hire part-time, even full-time medical coders to teach a remote class. And it's already done. She just needs to be there for support for the classes. And I think you get like $45 an hour to do that. But it's not like regular long-term 40-hour-a-week jobs. It's just the hour that you teach the class or 1 hour a night to supervise the online homework that's already pre-graded for you. So don't forget to look at community schools. My son's high school is now teaching a medical assisting course, and they have a medical coder teaching that. There's lots of resources, lots of places to look for jobs. Just don't give up. Just keep going. Be active. Trying to get rid of your apprenticeship. I did that before I even took my CPC exam. I submitted my associate's degree transcripts, because I took a coding class in that year from 1994, and they accepted that and got rid of my apprenticeship well before I even took the CPC exam. I had a friend write a letter on letterhead about, they know I've used these codes in my job forever and ever, and sent those two things in and got that approved well before I even took my exam. If she's already working it as a CNA, she is really overworked and really underpaid, and the hospital may not want to get rid of her as a CNA and let her be a coder. She may have to go to a different hospital to get a coder job, just because, you know, they want to keep their CNAs. They're like, you know, oh, bless her heart. She's working the worst job, I think, ever in the hospital. I really applaud her for doing that job. Bless her heart. She should go on and get her LVN and LPN. That's only 11 months. A lot more pay versus CNA. My website is medicalcodingbyjen.com. And that's where we're at. We're in the membership area. I've got some practice questions here in cardiovascular. Anybody want to take a guess at any of these questions to see what the answers are? Thanks, Patty. You're welcome. Very overworked. CNA is some rough work, guys. She doesn't follow on TikTok, but I hope she communicates with you. No worries. Yes, I got some study guides on there too. One for E&M, one for CPMA, if anybody wants that certificate, and one for integumentary and musculoskeletals. These are study guides from the exam, certification exam point of view, not from a coding point of view, but from the exam point of view. Be sure and join our Discord study group. It has rooms for employment. Also, we post any medical coding employer exams that we get. If they give you an exam as part of the interview process, we post them in there. Any job openings, like LabCorp had one for medical coder remote this week, I posted in there, and some other place, medical office, was 100% remote. In our Discord group, we have practice exam question rooms there too, and study advice there too. Super helpful. You're an X-ray tech wanting to get into medical coding. Awesome. Not sure where to start studying? Get you an AMA 2024 CPT book, and then come to my website here, medicalcodingbyjen.com. This is what the homepage looks like when you get there. And the fastest and most efficient way possible to prep for that exam is to just go to my resources tab, go to the CPT book prep page. I have 8 photographs here. Click on each picture. It'll tell you what to do and how to do it to your CPT book to prep it for your exam, because it is an open book exam, and we prep them all up so that you have a really good ICD-10 CPT book prepped, ready for any exam question that you're going to take. So, and then join in on my free lessons. I teach Monday through Thursday. Under the social media tab is my schedule. 2 hours for free on Amazon, on YouTube, and on TikTok. It's right there. And just start following along as you're prepping your little books. And I'll teach you from the certification exam the fastest, most efficient, and cheapest way to pass and get you a job in this area. I also have book prep videos here and on YouTube that will show you page by page what I'm doing and how I'm doing it, so it's super helpful. But just get you an AMA CPT book and get started. I'm building 17 areas of bonus practice questions and stuff here on my website for members of the website. And we were just going over some of the new exam questions if anybody wants to attempt any of these. You're prepping your book right now. You're on page 334. Awesome. I am taking pictures of 246. So I'm working on notes for the cardiovascular system for 2024. They're pretty much the same as 2023. I think there's 4 more CPT codes this year, but I'm just updating the photographs because it's been a little while since I've done these photographs. And then, of course, adding in the notes for the brand new codes for this year. And then adding medical questions to the member sites. Don't forget the YouTube site is really helpful. It has a community tab that you can click on that also has free practice exam questions. And there is a ton of free YouTube videos. Hours and hours of me prattling on for free, trying to help you guys pass the medical coding certification exam. I'm marking all the out-of-sequence codes. Oh, Lord. Joanne, whew, that's a chore and a half. I do have a PDF you can buy and just copy the answers down of all those, but that is a wonderful, like a rite of passage for every coder to do. Wait till you get to the lab and path and medicine section. There's one in medicine where the code is like 700 pages away from where it should be, and it always drives everybody nuts. Where is it? Where is it? I can't find it. And when you get there, just so you know, it's in the E&M section. So save you a lot of stress there. But super fun to do. It is needed for your medical coding exam. We have a lot of red codes. The easiest way to do that is to find the codes that have the black hashtag on them first. You find that code, then you can find the red one easier because it's where it should be. But the black one with the black hashtag is out of order. So every time I see one of those black hashtag ones, I stop there, note what page it's on, and then go find it where it should be in the red. And then at the red one is where I write the page number and the column number of what page it's on. You don't even have to write the column number. I just do that, but at least just the page number of where you found it. That will help you out during your medical coding exam because the book is supposed to be in numerical order throughout the entire book, but there are several codes that are out of order numerically, and it is incredibly frustrating to try to find it with their references. Sometimes they give you a range of codes, and sometimes they just tell you it's on a chart somewhere, and there's no label of where that chart is. So you don't know until you... It's just insanely crazy. Anyway, so when you find one that's got the hashtag on it, stop, note what page that's on, and go find the red one because it will be in numerical order, the red one. And then beside the red one, put the page number. Let's see. No, I don't want to do that. Wrong one. I want to do No. I don't know. My camera's not working. I was trying to add the camera, but it's not working right now for some reason. Maybe if I turn that off. No, that still didn't help. Oh well. It's just not working right now. Yeah, it's super, it's cheap. It's not, it's like, I don't remember how much it was, but yeah, you can just copy down the answers. So you don't have to do it. Let's see. I don't remember how much it was. Where are we at? In the shop. Let's see. I have every section of the CPT book if you want to just copy down my notes. There it is. It's $12. The 2024 numerical fix, it goes E and M all the way through the medicine section. I don't do the category 2 codes because those aren't on the exam, but you can just copy down all the answers right there. But I have a free practice area where you can do practice exam questions that are free, and then we do have a membership one. If you want to join my membership, it's just $6 a month, and you get access to all my E&M practice area. It has a ton of PDFs extra for you, and then it has one for integumentary that has a ton of PDFs, and practice exam questions go on for days. And I did a cardiovascular one yesterday that has a ton of PDFs too. And I'll add in all the other sections too. I still got a full-time job and 3 sons, and my mom just broke her hip, so I'm taking care of her too. So life is crazy, but I'm trying to build a lot of stuff for you guys. And I try very, very hard not to charge you anything, and give out most everything for free. Anybody got an idea on the primary function of the left ventricle? Anybody know what it does over here? Does it pump or receive? That's the first thing you need to deal with. That's the easiest part, is it pumping or is it receiving? What does the left ventricle do? Left ventricle, I think, is on the bottom. So what is that sucker doing?
Oh, sorry. Sorry. I'm so sorry. Was juicy.
Just type in chat what you think the answer is.
What'd you say?
Correct. Good job. What about the structure of the heart's rhythm? Which one is responsible for that? Four, 3, 5, 3, 6, 3, 7, 3, 8.
kidding at all.
Make like a frog and leave.
Travis, you're going to have to turn that down. My children have laid around in the lap of luxury all day long, not doing a darn thing. They have thoroughly enjoyed their Easter, I'm sure. Background is loud. I know, it's terrible, isn't it? You'd think my children were deaf. That is in another part of the house that you're hearing. They're not in here with me. B, the SA node. SA node is responsible for the heart's rhythm. Let's get you down to some medical coding ones. Let's skippy some of these. Let's do a bigger one. What about this one? Kind of a anatomy one, but I made it a lot bigger. The differences are the epi, peri, endo, or myo. It's still an anatomy question, but I blinged it all out with a ton of other information there. What do you guys think the answer is to this question? No worries. You know, the best way to learn is to get things wrong. Absolutely. You're not learning anything if you're just clicking the right answer every single time. So, perfect. You won't forget it next time. That's the best way to learn. It's awesome. Given the significance of this membrane and its role in the heart structure and pathology, how is it correctly identified? And what coding considerations must be taken into account when documenting such an anomaly encountered during a TAVR? We're doing a transcatheter aortic valve replacement. That happens in what membrane? Is it myo, endo, peri, or epi? Might be too advanced. Question. It's not for really beginners. But that's what you're going to face when you're doing my questions. Mine are pretty tough sometimes. But if you can do my questions, you're going to ace the medical coding exam without any problems at all. For sure. Thank you for the puffy hearts, Chicago. Alicia, thanks for subscribing. Yay. We'll take the money that we make on TikTok and we give away YouTube subscriptions. The YouTube subscribers get access to my exclusive videos, like the podcast where I'm reading out the CPT book and telling you what I think it means, each sentence in layman's terms. I have a ton of workshops that you get the replay of. Those have 75 practice exam questions in them. We do them in the same pace as the exam in 3 hours. I also have repeat duct classes, which are 2 hours, 30 to 40 practice questions in those duct classes. I do more teaching in those, so it's a little bit slower pace, but super fun. Great way to get the replays, and we give out a lot of those subscriptions during the lives that we do on Tuesdays and Thursdays on YouTube. That subscription is also just the $6 a month, $5.99 or $4.99, something like that. I think it's $4.99, and we give out a ton of them during our lives anyway. Mondays and Wednesdays we're live on TikTok where we do book prep and other Q&As, whatever questions y'all have. Tomorrow, Monday, we will not be live on TikTok because I have to take Travis to a doctor's appointment in Vegas, and it's 2 hours away. And then I got to drive back. It just makes for a long day. 4 hours in the car.
next time you order a Walmart grocery store, can you add Fruity Pebbles instead of Frosted Flakes?
No, it has red dye in it. No.
Mom, you need to look at this. Everything has dye in it.
No, it
Yellow
doesn't.
dye, purple dye, red dye, blue dye.
Yeah, and you're going to avoid it. You're not going to eat it.
What's so wrong with it?
It's bad for you, bad for your anxiety, bad for everything. Bad for your acne, bad for cancer. It's bad. You're not going to eat it. Or you Fruity Pebbles. No. Yep, that's my little booger. That's my Travis. Let's go to the E&M practice area. I get this one to line up pretty good. Some of them just not lined up all the way. What about, let's see, can I make it bigger? There we go. Which statement is true about E&M services in the home? Has it got anything to do with travel time, rest homes, cannot be differentiated, or a home may include a private residence or whatever else? Which one of these statements is true? So there's 3 incorrect answers. Which one's correct? (43) and 44. Let's see. D is correct. A home may include a private residence, temporary lodging, or short-term lodging, like campgrounds, those kinds of things. So D is correct. Good job. What about what requirement is essential for coding nurse facilities services after January 1st, 2023? Is it codes are based off patient's conditions? Do we need to have medically necessary exams and history? Only the primary care physician? Or all nursing facilities need something? What do we think the answer is to that one? Hey Joanna, good to see you. Thanks for all the taps and the shares, the subscribing, the puffy hearts. Super cute. 70, 71, 72, and 73. I'm so tired of those kids listening to that, whatever that is on YouTube. It's a pain. I think they're ghost hunting or something. B is correct. They changed the MDM guideline to do just the history and exam. As appropriate. You know how they changed everything from history and exam? Just needs to be an appropriate one. We're not doing the levels of the history or the levels of that anymore. Everything has to be MDM or time-based. Kind of a trick question, I think. I don't know. In a medical team conference, what is required for 99366? Do we need to have at least 3 physicians? Oops, I clicked the answer. Sorry. Sorry. So that one, what was the answer? C. C was the answer. We'll move on to the next one. Okay. What is the key requirement for reporting telephonic medical evaluations? Do we need face-to-face in the next 24 hours? Do we need a minimum of 20 minutes? It should be unrelated to any other E&M service, or only physicians are allowed to do telephonic evaluation services. What is the key requirement? What do you think? Discord's going crazy. Perfect. C. Yes. That unrelated to any E&M is what you need to look for sure. Which statement accurately reflects billing of newborn services? 99463. Is that an admit and discharge in the same day? 99460 is for any newborn care. 60 or 53 should be used based on whether the physician discharges the patient. Newborn care services do not differentiate between hospitals and non-hospital births. 3 of them are incorrect. Only 1 is correct. What do you think? Perfect. Stay away from things that say always or never. Those are clear indications that those are incorrect, usually in medical coding. So that helps out when you're doing the wordy questions. Which statement accurately describes billing for prolonged services? Can occur on the same day as an E&M service, are used to report time spent direct patient care, can be used with medical conferences, and can be used for non-face-to-face services. Which one's correct? Big guess B. Previous one was C. Hey, Go-Kart, good to see you. How's it going? H&D, thanks for the follow. Hope I can help you out. Thanks for sharing the live and tapping the screen. Alicia, thanks for subscribing. Thanks for the puffy heart, Chicago. Anybody guess on this prolonged service question? We're looking at practice questions I wrote. What in the heck's going on here? I need to edit this. See what in the heck I did with this page. Where am I at? I am in the E&M section. Go-Kart, as you're looking at my website, be sure and let me know when you see errors of any sort. Let's see. This E&M page. It looks like question coming up like what is included in time spent by provider. There's like just a D and an A. It looks like a bunch of questions got squished together. Where am I at? Prolonged services. And see, on my end, it doesn't look like that at all. What is included? That is so weird. It does not look like that at all. Let me move that on down, and then we'll move this on down. Oh. Let's move this on down. And let's hit publish. And then we'll go back here and hit the refresh button. See if it refreshes. Where were we at? We were right here. There we go, that looks better. Anybody got an answer for this prolonged service question? Happy Easter. D. These codes are only used for non-face-to-face visits. Isn't that crazy? Yep. Our prolonged service code that goes with E&M is what, guys? It's 99, not 3, but 99417. That's the one that goes with your E&M services. All right, why might codes 455 and 456 have limited coverage under Medicare? Oops, I hit the button. Oh good, it didn't show up on here for you guys, but is it that they are exclusively used for inpatient setting, or they represent a typical covered workman's comp? Is it that services under these codes are not deemed medically necessary, or Medicare covers these without any restrictions? Yes, the correct answer is B. I hit the answer. It's just a work-related code, so Medicare won't pay for workman's comp stuff. That's an easier question. All right, what is the key in determining rendered for critical care services? Oh, cool. Patient must be designated as critical care. Only one physician. Services must result in immediate improvement, or a minimum of 60 minutes is required. What's going on with our 99291 codes? Yeah, it shows y'all B. I was hoping it wasn't showing it off, but it did. A is correct. Next section is a little overlapped. Let's see. I got the no teller. Where did I go? Ooh. Look at that critical care code question. You think I put enough propaganda in here? Some of my questions got really long last night as I was writing them. I'm like, ooh, I'm trying to be AAPC over here with some propaganda. Remember, don't read the questions. Just go to the answers and look at those individual differences. Let me go over there and see if I can't make a difference with these. Let's see. There we go. All right, refresh your screen and see if that made it any better. Okay, go-kart, thanks. What do you guys think the answer is for this critical care one? Did you send it on Discord? That's MK. There's go-kart. Me giggles. I haven't seen her in a while. Hey Jen, I have a question. All your notes. My last set of books. That was a message from January. I'm so bad. Oh my gosh, I got messages. What month are we in? We're almost in April. Jeez. MK's birthday was on January 19th. I miss MK. I hope she's doing okay. Thanks, Go-Kart. B. Is it working? What to do? I wonder if it wonder what it does depending on which device you're on. Lord, at the questions I got. I got questions for days. That is the correct answer. Just not sure what's going on with my question here. I gotta go figure out what's wrong with that one. It's not answering. Lord. That's a big one too. Are we a new patient or an established patient? That's the first thing to look at between these answers, because 2 of the answers are new and 2 of the answers are established. That'll get you down to a 50-50 shot. You see up here she's established, so you know it's going to be B or D. Now you're down to a 50-50 shot. Now without MDM and without time, maybe you can see what you think the answer is. Might be an MDM in there. Does say right here a little something something. Hey Mackenzie, good to see you. You know the 11 is a nurse visit. Who saw her today? D is correct. Good job. These are all established. 2 of them have the 12 in it with just different diagnoses between A and D. Perfect, perfect, Joanne, perfect. Be sure to refresh that page, Go-Kart, because I updated the spacing. Maybe it'll work better now, or looks better. Looks like it's going to rain again here. You like B? C was the answer. We have a moderate MDM right here. We have a patient with strep with an infection in the ears. We did cultures, antibiotics. And this one you just had to match up the moderate MDM with the level that meets the criteria for moderate. This one's already showing the answer. I gotta fix that question. Whew. Y'all, if y'all knew, I have to go in here and let me switch this out. I'm no computer genius, for sure. Is it this one? No. That one. No. This is what my site looks like to me. And see, I have to go in here and edit this white box for every single question to make sure it's right and functions properly. So when questions are only showing answers or they don't show the answers, I have to go in here and fix all this mess, and I don't know what the heck I'm doing, but I'm trying. I'm a-trying. So I have one. Over here is where y'all should be. Get y'all back over there. There we go. Nope, wrong one. Travis, turn that off. Here we go. See how this one's already showing the answer and it's not in green? I know there's something wrong there. I gotta redo something for that one. Fix it somehow or another. Alright. And then all of a sudden my code started putting these white boxed areas around the questions. I don't know why. I have no idea. But it's there and it's working. These two are A and B are discharges. And then you need to figure out what C and D are. And then look through the question for just those differences. Did I discharge that patient today? If so, what's my MDM level? If I didn't discharge the patient today, then am I C or D? I'm 66. All right, go kart. Tamara passed. She took her exam. Congratulations. Oh my gosh. Aw, that is so sweet. I think she would have found a way to pass.
Boys, Gabriela and Juicy and I were in medbay since the start of the round. It couldn't have been any one of us. So it's gotta be Smashing or Josh.
That's awesome.
This one right here. This one, you talking about this one? I gotta clear asteroids too. It's Josh. We both Josh.
What about this question with Dr. Anderson?
Okay. Oh, I saw a red right there. I thought that was Josh. My bad. It's easy to confuse you. Okay, Gabby, do your test, okay? I'm gonna do this one.
Which E&M code would you guys bill for this one?
I should say it's Josh. And then I stopped hearing him.
No worries, go kart. Don't worry. Refresh your screen too and make sure it's still messed up. I've been editing it.
Wait, who was standing? I pressed the button. Me, Eddie. Who was standing right here just now? Okay. All right, boys. Now you shut the fuck up. You're the only one. Hold on. You stay right there. Juicy, say what you're gonna say. You got 60 seconds. Go. Okay, now, here's what happened. Me and Gabriela and Smashing were together since the start of the last round.
If
Smashing,
you turn your device to the landscape, you might be able to see the question better.
he stopped, right?
Anybody want to take a guess?
Here to check on Smashing, and Gabriela's right behind me, and there's a dead body right here. I swear, dude. Smashing was about to. Oh, you shut up. Smashing was about to press the button. And Josh was standing right here. Fuck, we have 2 seconds, pendejos.
Your feet are cold. What do you guys think the answer is? You can type it in chat. Don't be afraid. Get on some slippers.
Red's not an imposter. I know Red's not an imposter. Red's clear. Juicy, I'm gonna do my test.
click. Got it.